Welcome to Noon Wednesday. I'm Marissa Wojcik, multimedia journalist with Here and Now on PBS Wisconsin. Today is February 2nd. COVID cases in Wisconsin are plummeting even faster than they came on, and hospitalizations and deaths due to COVID-19 appear to be following this trend. So is this a reprieve that we can count on? And what is the status of testing, other variants, and vaccines? For all this, we go to Here and Now reporter Will Cushman, and he joins us to talk about all things COVID. Will, it's really good to see you.
Hey, Marissa. Thanks.
So let's talk about case numbers, particularly in Wisconsin. What do new positive cases look like?
Sure. So the 7-day average that the Department of Health Services reported yesterday was about 5,500 new daily cases. And while that still is quite high, it is a lot lower than it was even 2 weeks ago. It's less than a third of the 7-day average that was recorded for 2 weeks ago when it almost hit 19,000 cases per day. So the Omicron spike truly does look like a spike when you look at it on a chart. It's like almost straight up, and we're on the downside now for now, and it's almost straight down. So yeah, we're definitely trending right now in the right direction. But yeah, we'll see what happens.
And typically a lagging indicator of COVID cases truly retreating is looking at hospitalizations and deaths data. What are those looking like?
Yeah, great question. One thing that was actually kind of interesting about the Omicron wave in its kind of one of its many differences from previous waves was that hospitalizations actually tracked pretty closely, or the trend in hospitalizations tracked pretty closely with the trend in cases, and hospitalizations actually peaked a little bit earlier than the cases 7-day average. That might have been impacted by the kind of the data issues that the Department of Health Services was working out earlier in January, which may have delayed the peak in cases. But yeah, hospitalizations have been trending downward over the last few weeks as well. They're also down about a third from their peak that we saw a few weeks ago. And deaths are also starting to trend downward as well. They're also down about a third from where they were about a week ago. Right now, there's about 24 new deaths reported every day compared to about 36 new deaths reported every day that we saw about a week ago.
So this is all good news, but these numbers, by all accounts, are still, we should still consider these high, correct? We're not out of the woods quite yet.
Yeah, a 7-day average of 5,500 new confirmed cases across the whole state is still really high. In fact, that would be close to record setting prior to the Omicron wave. In late 2020, that was the previous kind of peak of cases and disease in Wisconsin, and the 7-day average got up over 6,000 for a little while. So we aren't too far off from that still. So while it definitely, we're heading in the right direction, and it feels like things are getting better, and in fact, the data shows that they are, the situation is getting better from like a really bad surge. So yes, things are still quite intense in terms of transmission, and all 72 counties across the state are still reporting critically high transmission, according to the state health department.
And you alluded to this, but, in the fall of last year, it was a Delta wave that was really crushing hospitals and health systems. And really quickly, right after the Thanksgiving kind of holiday period, Omicron just all of the sudden emerged. And so the cases that we're talking about that spiked and are now retreating, are those all pretty much attributable to this Omicron variant?
They are, yes. The Wisconsin State Laboratory of Hygiene does genome sequencing of a certain number of specimens taken from people who test positive, as do some other labs around the state. As of mid-January, the state hygiene labs kind of publicly available data showed that 98%, essentially all specimens that were collected and analyzed through genome sequencing in January were caused by Omicron.
It's very hard to fathom that quick of an emergence of a variant. And so it's good news. Omicron does appear to be reliably decreasing, decelerating, but there's news now of an Omicron subvariant circulating. So what do we know about this subvariant, and are there other variants that could hinder this case decline and the progress that we're seeing at the moment?
Yeah, no, great question. That subvariant is known also as BA2, and it's pretty closely related to what I'll just call like the original Omicron variant. You'll see in the news, some people might call it like a stealth Omicron variant or something like that, but it's essentially scientists are calling it a subvariant. The WHO has not given it its own kind of Greek letter, and that kind of indicates that it is pretty closely related genetically to the original Omicron variant. And in fact, it was identified only a week after the original Omicron variant in Southern Africa, where the Omicron variant was also detected first in November of 2021. And at the time, it was kind of believed that the Omicron variant, the one that has since swept the globe, would be the one that would do that, and this other one, and then there was actually another subvariant identified around the same time, may not basically be able to compete with regular Omicron. But since then, we are seeing in a growing number of countries and states, including here in Wisconsin, this BA2 subvariant being identified. And in fact, in some places where it was identified earlier, Denmark, United Kingdom, some other countries, we are seeing that it's kind of taking over transmission from regular Omicron. And it appears like it could be even more transmissible than regular Omicron, which is extremely transmissible to begin with. It could be 1.5 times or 50% more transmissible than regular Omicron. Scientists are still trying to figure out why it is more transmissible, whether it is better at evading immune responses than regular Omicron, or whether it just has mutations that make it just inherently more transmissible. So that's still being kind of figured out in real time. But it's definitely something that public health officials, the WHO, CDC, State Department of Health Services, and others are keeping a close eye on, as they are keeping an eye out for new variants. And with billions of people around the world who still have not been vaccinated, there is a lot of basically natural laboratories for the virus to continue mutating and for new variants to arise, potentially dangerous new variants.
So when we think we can take a deep breath, we're kind of immediately confronted with something new. And I apologize, we can hear my dogs barking in the background, so it's proof that we're in our homes and we're alive. Let's talk about testing and testing sites. So getting a COVID test last November, December was extremely difficult, nearly impossible. There were these long wait lines, expensive at-home rapid tests if you could even find one on the shelves of the pharmacy. And it seemed like the public health response was behind when it came to testing and having an impact of kind of preventing this wave as we're seeing it coming. Was the public health response appropriate? And does it seem like officials are actually trying to prepare for when these waves are upcoming?
Yeah, that's a great question. It did seem, especially when Omicron hit Wisconsin right before kind of the year-end Christmas and New Year's holidays, like people, everyone was kind of scrambling for tests and finding a test, whether it was through a clinic, like getting a PCR test or a rapid test was pretty difficult to do. And it did feel like once again in this pandemic, like the public health response was one or two steps behind the virus. And in fact, we knew basically since the Omicron variant was detected in late November that it was likely to be coming to the U.S. and to Wisconsin, along with a crush of new cases. So yeah, I think there's an argument to be made that the public health response was not quite prepared for quite the onslaught that we saw at the end of 2021 and the truly crushing demand for testing. And since then, we have seen some new, or not necessarily new, but community testing sites reopening around the state, and as well as some new federal programs or whatnot, resources for obtaining and getting reimbursed for rapid at-home testing that was not really available when everyone was seeking out these tests at the end of 2021. But that demand for testing seems to be receding a little bit. So testing is definitely more available than it was even a month ago.
And along those same lines, while the demand was really high, you've been looking into a little bit that there are some testing sites that have popped up that seem as if they might not be legitimate, and it's hard to tell who's running this site. Is it something that you can trust? What have you learned about these testing sites, and are any of them full-on fraudulent, or are they just questionable? What kind of information should they ask you for? What can you tell us about some of these maybe less than trustworthy testing sites?
Yeah, it does appear like there have been some folks who maybe have taken advantage of the situation a little bit in terms of the demand for testing and kind of like a lack of available testing that we saw last month. And there have been a lot of, for lack of a better word, I would say testing clinics or testing sites popping up all over the state that advertise free PCR tests or rapid tests, no insurance necessary. And while not all of these, definitely not all of these are illegitimate, some of them have definitely drawn complaints from people who have tried to use their services and get tested, people not getting their test results back, complaints about kind of the sanitary practices at some of these places, some of the information that they're seeking from people seeking tests might seem a little suspicious. And so actually the state health department and the DATCP, the Department of Agriculture, Consumer Protection and Trade in the state, put out an advisory last week, essentially telling people to be on alert for potentially fraudulent behavior at testing sites, and really recommending that you seek out testing from a public health department if it's available, at a free community testing site, or through your doctor if you can get one there, or your pharmacy, or through your children's schools if testing is available through them. Going through these avenues that we know are safe and are going to protect your information. The state health department has also kind of shared a few red flags to be on the lookout. If you do go to one of these other kind of third-party testing sites, those include if they're asking for cash, that's a red flag. They shouldn't be asking you for payment, especially not via cash. They shouldn't be asking you for personal information like your social security number or your driver's license number or anything like that. They may want to check your ID and get your insurance information if they plan to potentially get reimbursed by your insurance. But they definitely should not be getting your social security number or anything like that. And the state health department also just recommended going to their website, they have a map of testing sites that they've vetted and they know you can be assured are legitimate then if you go to their website and check that out.
Very, very strange development, but luckily isn't something that hasn't arisen on a mass scale as of yet in the pandemic, so that's good. Let's move on to vaccinations. Are we seeing a rise in vaccinations at all after this Omicron spike? Has it really motivated any new groups of people to go and get their shot?
Yeah, I would say vaccinations are increasing probably at a similar trajectory that they were prior to Omicron. I think looking at the data, uptake in booster shots definitely seems to have improved since the Omicron wave hit. That was one of the main recommendations from public health officials. That if you're eligible for your booster shot, that you should get one to protect against an Omicron infection. But overall, we're still seeing a couple thousand people getting newly vaccinated every day across the state, which is by no means like a small number, but it's not that much larger than we were seeing kind of in late 2021. Right now, just under 60% of the state population is considered fully vaccinated. And a smaller portion has been boosted. So the vaccination numbers are still increasing, but fairly slowly. And we are seeing some places, the city of Milwaukee actually just announced another cash incentive for anyone who is newly seeking out vaccination beginning tomorrow, actually, Thursday, February 3rd. Anyone who gets newly vaccinated at one of the Milwaukee Health Department clinics will get a $100 gift card. So there's still work to be done for sure. But yeah, that's kind of where that stands.
And yesterday, Pfizer announced that it is seeking an emergency approval for vaccinating children under the age of 5. Many parents of young children have been waiting for this, have been worrying about their kids. And it's the same vaccine that adults get, but it's 1/10 the dosage. But in data trials, they've only been doing 2 doses. And there's been mixed results, so they're hoping the approval will go through and a 3rd dose will do the trick to get this age group enough immunity. What is happening here? It seems kind of muddled and confusing and less kind of a bright light that we saw in other age groups as these vaccines have emerged.
You're right. This situation is a little bit different than authorizations for previous age groups that we've seen for COVID-19 vaccines. And yeah, as you said, there are a bunch of national reports yesterday that Pfizer and BioNTech would be seeking authorization for their vaccine for children ages 6 months to 5 years. And it's kind of surprising based on, as you said, those mixed results of their initial trial with the 2-dose regimen of that dosage that's 1/10 of the adult dosage. Those trials showed that in children ages 6 months to 2 years, they actually the regimen elicited a good immune response. Now for children ages 2 to 4, the other part of that age group, that they didn't see that same immune response. I'll note that there's no question about the safety of this dosage in these children. The trials showed that the dosage is very safe, and children in this age group tolerated it quite well with minimal side effects. But it's really about the efficacy, whether the 2-dose regimen in those 2 to 4-year-olds is really enough to elicit a strong enough immune response. And so the reporting that you're referring to that I've also been tracking This is kind of interesting. It sounds like FDA officials were actually encouraging Pfizer and BioNTech to seek this authorization this month in February with an eye toward eventually authorizing a third dose for those children 2 to 4 years old as well, and maybe for the whole age group. But it's definitely, it's a little bit different than how this process has worked for other groups. And I think part of that is just the wanting to have a vaccine available for this age group. This is the only age group that vaccines are still not available for. And as we saw in the Omicron surge, or as we are continuing to see, some of the youngest children are being infected at much higher rates than they were previously in the pandemic. So I think there's some urgency on the part of federal regulators to try to begin building vaccine-derived immunity among this age group.
Have kids in this age group and kind of children in general been left out of the conversation too much, as people say, well, the younger you are, the milder the case you will have? Is that discounting the fear that a lot of parents have that their children will get infected and sick with COVID-19?
Yeah, I think that's a fair question. And there's actually an infectious diseases expert on PBS NewsHour last night talking about this a little bit in how, in her view, she's involved in these trials among this age group. In her view, the threat of COVID-19 in this age group has been maybe a little underplayed. And in fact, it is true that children are less likely to get severe symptoms when they're infected from COVID-19. They're certainly much less likely to die from COVID-19 than adults, and especially older adults. But as she pointed out, the number of children ages actually 5 to 11, so this is a little bit older, who died between October 20 and October 2021 from COVID-19 would have put them at, like, that number would have been the 8th leading cause of death as reported by the CDC in 2019. So it's not like there aren't children dying from COVID-19. It's not like there aren't children who are getting very sick from COVID-19. And in her view, and I think the view of a lot of parents, we should really be treating the threat of COVID-19 to small children more seriously than maybe a lot of people want to.
And the vaccine is available for children over 5 for parents who haven't wanted to get their child vaccinated yet. And it's expected that this vaccination for children under the age of 5 could be approved as soon as the end of the month. So we will be tracking this and I'm sure checking in with you. But in the meantime, Will Cushman, thanks very much.
Thanks, Marissa.
For more from Here and Now and PBS Wisconsin, you can visit pbswisconsin.org/news. And thank you so much for joining us on Noon Wednesday.